My name is Mel Taylor, Credentialed Diabetes Educator. The title of this video is Insulin's Not So Scary, and to me that's true. However, to you, who may have been told by the doctor or your diabetes educator that they think this would be a good treatment for you, it is scary. Some of the things you might be thinking are, how long do I need to stay on insulin? Oh my gosh, I hate needles. However am I going to be able to inject myself? How many times a day will I need to inject myself? And I've heard that insulin is the last resort. My GP threatened me with insulin if I didn't look after myself when I was first diagnosed. People die after they start insulin. Let me see if I can allay some of these fears and explain more about how insulin can save your life and you can live a happy and healthy life with diabetes. One goal of good diabetes management is to have good blood glucose control. Over time, the condition of diabetes progresses despite a person's best efforts with lifestyle changes, and especially if the person has been diagnosed at a young age. Medication is required at this time to bring the blood glucose levels into the target ranges. Insulin is just another medication used to control blood glucose level, and it works really well. There are several different types of insulin. Some are long-acting and given once a day, others are rapid-acting and given with meals, and some are a combination of the two. It can be used in combination with oral medications or on its own, and this would be determined by your GP or diabetes educator reviewing your blood glucose levels. Insulin is given to mimic the body's own production of insulin once the pancreas has got exhausted and is unable to produce enough insulin to keep the blood glucose levels in the target ranges. I have known people to commence insulin and then been able to reduce the amount they use. However, like many medications, once you start using insulin, you would continue to use it. Needles are scary, mostly because people imagine them to be the ones used for taking blood, or like the flu needle, or an injection when you go overseas. Insulin needles are nothing like that. They are fine needles, and the shortest needle is 4 millimeters long, and this is the length anyone can use. Many people say that doing their finger prick test is more painful than giving their insulin. Insulin comes in both disposable pen devices and cartridges, and they are easy to carry, store and use. Your diabetes educator will teach you how to inject, store and manage your insulin and the doses that you require, so making an appointment with them is the best thing to do when starting insulin. Many years ago, when there were very limited insulins available, it was used when oral treatments were no longer effective, and this was often towards the end of a person's life, and they died. This is why, for so many people, it was associated with that person's death. Insulin is no longer used as the last resort when treating diabetes. Insulin now offers a good way to manage blood glucose levels earlier, in addition to oral medication. The types of insulin available now give more flexibility to treatment and result in better control of blood glucose levels and helps people to live longer and with less risk of complications occurring. No one should ever use insulin as a threat to someone living with diabetes, and hopefully these days this occurs less frequently than it did in the past. Like some oral diabetes medication, insulin can put you more at risk of having low blood glucose levels, so understanding hypoglycemia, what causes it, and how to prevent and treat it is essential. Go to my video on hypoglycemia to find out more about it.